The main concern in the services for diabetic retinopathy is the need to improve the quality of life for the patient. This is the patient who has diabetes, the patient who has diabetic retinopathy, and the patient who has visual impairment from this complication. This means we must address the barriers that the patient faces, such as barriers to accessing screening for diabetic retinopathy. Such a focus is often described as patient-centered care. What exactly is patient-centered care, and how does it differ from disease-oriented, provider-centered, or facility-centered care? It is concerned with the patient as a whole person, instead of viewing and describing the patient in terms of their current disease status, such as diabetic. It is well recognized that some of the patients do not like to have this term, diabetic, used to refer to them, while some other patients do not mind it, and this introduces some complexity. Patient-centered care is a quest to have informed patients, that is, patients who understand their role in the control of diabetic retinopathy and the options that are available to them, and also to have an optimal patient healthcare provider engagement during, say, a consultation or education session or other service. It also means taking into account the personal history, family history, preferences, and values, and involving the patient in decision-making about their treatment. Patient-centered care implies a focus on all aspects of the patient's health needs. This includes the impact of diabetic retinopathy on their psychological state of mind and their socioeconomic circumstances, such as safety, mobility, and employment. There is evidence that patient-centered care enables better outcomes at low cost, and this makes it worth considering in all populations and in all healthcare settings.